Computer. Hi, everybody, and welcome to another episode of the Serdentity podcast. I am your hostess, Elizabeth Dewar-Anthony, and today I have with me the great Dr. Steve Carstensen, a leader in our field. We met in person at the PANI conference in April, and he's from the Pankey Institute. He knows everybody, and I wanted to just speak to him today about some of these Serdentity concepts that I'm trying to get out there. So Serdentity is a combination of serenity and dentistry. It's a word I made up. And I've been talking about dental fear for 20 years. But it wasn't until I started studying orofacial myofunctional therapy that I realized, duh, it's the airway. I mean, I knew there was a post-traumatic element to it, but it's the airway. So what I'm trying to do with my Roots of Dental Trauma talk is introduce dentists to these concepts and tell them that these patients that are making your life miserable are not doing it they're not doing it on purpose. These people are trying to survive. They're trying to breathe. And a lot of these behaviors, the gag reflex, retained oral reflexes that, make it harder for us to work. They're not doing it on purpose. And there are things that I can do. Serdentity is about me understanding that these patients are just trying to survive, not take it personally, and try and approach the whole situation with a very calm, non-judgmental demeanor. And it's worked for me for 20 years. So I just want to get it out there.
Very good.
So I'm in a bunch of face groups of dental hygiene and dentistry. And what I see a lot is dental professionals, complaining about negative patient interactions. And a lot of them have to do with, the patient doesn't want to do this, they don't want to do that. And the patient generally just not doing what the practitioner thinks they should be doing. I wanted to talk with you today about the second ethical principle. The first ethical principle is do no harm. The second ethical principle is patient autonomy. So I find that very interesting. And what I see is a lot of dental professionals getting very frustrated because patients they say they're dictating treatment. And my observation is, well, they're going to dictate it anyway, because they can say whatever you can hard sell them into a procedure, but then, they don't show up. So what do you think about all that?
Well, what you asked earlier about Dr. Pankey and my training in dentistry is really founded on Pankey principles. And what Dr. Pankey told us over many, many decades, and as we shared just before we started recording, I'm fortunate that I was able to be in one of his last classes. And so I actually heard it directly from him. But what guides us is the relationship that we have with our patients. And you can't, some transactional relationships are necessary. You walk into the store, you put your money down, you take your product, you go home. That's a good transactional relationship. And if it's a pleasant place to do business, you go back and do it again. But when you're dealing with a personal item, a personal service, a personal change to yourself, an opportunity to get better, a chance to stop from getting worse. Those are all relationship-based interactions. And we can't do a proper relationship-based interaction without getting to know each other a bit. So when a patient comes into my office, and over all these years, and today I don't see restorative dental patients, but I see people that have breathing problems. They walk in, I can't think about them as okay. They're walking in with a bag full of money, and I'm going to do something for them. I'm going to exchange what I do for them for that bag full of money. That's not part of what I do. We do have to get paid. I mean, as a business, we'll set that
Yes.
aside. But what we have to really realize is what Dr. Pankey talked about: getting to know the patient and understanding, what it is that's their goal will allow us to apply our knowledge and give them something in exchange for their resources. And
Yes.
that's something that we're giving them is in some cases restorative dentistry, in some cases a mandibular advancement device to keep their airway open. But what we're really giving them is something that cures a disease, something that gives them an increased quality of life. So those things are so vague and so personal of definition
Mm-hmm.
that it can't be reduced to a transaction.
Mm-hmm.
It has to be a relationship, and so getting to know that patient and what that means. I'm sorry, go on. I guess I hear a little bit, but what that
No,
means
I
is
love it.
you have to give them a chance to tell their story,
Yes.
and that storytelling time is the most valuable time we ever spend with a patient.
Mm-hmm.
And that means we have to have proper leadership skills to get them to that place. Our team has to allow that to happen without complaining about how much time it takes. We have to, you know what? Let me say that a different way. Our team has to allow that to happen, recognizing the value of the
Mm-hmm.
time we spend.
Mm-hmm.
And then also the patient has to feel like we're well heard. So we have to have good listening skills.
Mm-hmm.
None of those things are taught in dental school. We don't get that straight away. We have to go to places like Pankey Institute and pay
Mm-hmm.
attention and listen to different educational resources. Then we have to make up our mind that that's how we're going to run our businesses.
Mm-hmm. That is amazing. And so how come that doesn't happen like all over?
Yeah. Okay. Because there's a really pretty straightforward explanation for that. Because we have business coaches out there that talk to us about how we can do our business better. And if you go to MBA school, or if you come out of a transaction-based environment where you're selling things or you're selling services, or you're in a corporation where there's numbers that have to be met, and you go to what could be a relationship based business and you don't recognize that, then what you can overly focus on is the numbers.
Mm-hmm.
And again, we have to pay attention to the numbers. It doesn't do anybody any good. We didn't go to all that school. We don't have all that debt in order to not make any money. That's a given.
Of course.
But the money has to be, in the early days, my mentors would tell me, "Oh, you do the right thing and the money will follow."
Mm-hmm.
Well, there's some truth to that,
Mm-hmm.
but there's not 100% truth for
Right.
that.
Right.
You have to do the right thing. The
Yes.
money will follow, but a good business person also keeps an eye on the money. And so
Absolutely.
what we do is we intentionally set our workflows so that we can get paid for the time we spend and we can provide such superb value
Mm-hmm.
that the money, should flow because people feel like they're in the right place to get the right thing done by the right person at the right time. And so, why is this not taught? Because it's so much easier to gather data about a business and say, okay, well, you know what? If you did this many more of those things, you would make this much more money.
Mm-hmm.
And that's been really true in my field. My part of dentistry of medicine is sleep apnea because you can sell things, sell appliances.
Mm-hmm.
And it's not difficult to get a patient to say, "Oh, I really don't want to snore anymore. So yeah, let me give you some money. You give me one of those things."
Mm-hmm.
That's not difficult to do. But when especially if you've been at it for a little while, so it's tempting to
Mm-hmm.
start counting up how many of those how many sales you can make and think, oh my gosh, we can make, 500 more $1,000 this year. If only we sold 10 of these a week, kind of a thing.
Mm-hmm.
That's pretty easy to wrap your head around if you don't have a values-based orientation, if you don't have a commitment
Mm-hmm.
to the relationship part of the practice, such that the concept of adding up how many things you can sell doesn't really fit well in that organization of your practice.
That
Okay.
is, thank you for that explanation. And so you're talking about patients need to be allowed to tell their story.
Right.
So I'm looking into, you know, Facebook pages where, how not to get sued, and, the 5 things that you should do. So the first one is like identify problem patients. So, this patient comes in and they have a story to tell, and they get labeled immediately as a problem patient because they've been traumatized by another practitioner. So straight out the gate, this person, and this person comes in and it's like, oh, this person's going to be, oh, look at all the red flags. I saw a dentist refer to a problem patient as a pimple on my tush in a Facebook post, and I was really sad.
Yeah.
This is a human being. These people are coming to us for help. They are hurting. And so I love what you're saying. I just wish I saw more of it in real life. I've worked in 100 dental practices in Colorado and in New York, a couple in Garden City, Kansas. And what you are describing, I have seen little to none.
Well, I'll echo your sad response to the very unfortunate Facebook post. I mean, it's interesting. You put a post like that out there, and it would be enlightening to ask what people's reactions were to that.
Mm-hmm. Oh,
You
there
know,
was all
because
kind. Oh, yeah, good for you. Good for you. You got rid of that problem patient right away.
yeah, okay. So I don't I'm not a social media um I don't go on social media and pay attention because honestly,
Right?
because when I see responses like that, I go, oh, that makes me more sad. And so why would I
Yes.
do that to myself, So the sad part about that response is that the response that makes me sad that further is other people's responses to that one. I mean, the cheerleaders for that thing is just not doesn't fit with me very well.
Me either.
Yeah. Now, does that mean that we have to? I mean, I'm such a non-absolutist, which means there are
Mm-hmm.
people out there that I don't want to deal with,
This is true.
and not everybody matches with everybody. I get that,
Mm-hmm.
but to have a category of people, a category potential that you might assign somebody into as a problem patient, and build your office culture around the fact that there can be people like that is such a I don't know. It's just a negative way of
Yeah.
approaching the world. I somebody comes in. I meet plenty of people that aren't happy to be where I were with me. That aren't happy about how they've been treated so far.
Mm-hmm.
Aren't happy about the fact that they've had these issues going on. Not happy because they don't sleeping well,
Right.
and so they're grumpy. And so they sit down and I give them an opportunity to share about that, and you have to control those conversations,
Yes.
but there's kind ways to guide somebody to tell their story and ways that make uh, open for you to make a difference for them, so you can be an empathetic listener
Mm-hmm.
without letting them control everything,
Right.
because I don't
Right.
need to hear about how their daughter-in-law is such a mean person. I don't need
Mm-hmm.
that. I need to know how they're not prepared for their day because they're not resting well,
Right.
kind of
Right.
a thing, right? And so I don't mean to pick on daughters-in-law. That's
No.
not
No. Although,
so
part I had a great mother-in-law. Um, so part of this patient telling their story, especially somebody who's been traumatized,
yeah.
um, I think, and I completely agree with you that we do have to. Time is money, right? So we all we can give anybody is our time. So we do have to kind of guide the patient in this telling. But I think it's really important for patients to be able to say, I went to this other office and I felt like, I ended up feeling bad. I was in pain, and they said this, they did this. That Maya Angelou quote, they'll forget what you did, they'll forget what you said. They will never forget how you made them feel. And that's it for me. I don't want anybody to ever leave my chair feeling beat up and ashamed.
Right.
And it's I don't know why it seems to be such a radical concept.
We think about breathing. That's something you and I pay a lot of attention to in our practices. And so if we think about breathing and what the yogi masters have been doing for thousands of years is
Mm-hmm.
calming the brain and affecting the autonomic nervous system, although they didn't know that back then,
Right.
that just by breathing properly. Well, what does that do? That allows the body to return to homeostasis. And
Mm-hmm.
I've long said that homeostasis could be my favorite word
I love
because
that word.
the what it means is so important for health. So if we help people allow their bodies to return to homeostasis, because you as a myofunctional therapist or a dental hygienist, and me as a dentist or a airway therapist, we don't make anything happen to another person.
Right.
We allow their body to return that way. So if we give them that opportunity, then we give them a chance to feel differently about their environment. And many times when we meet them, they haven't been given that opportunity. And
Mm-hmm.
the chance to tell their story is oftentimes part of returning to homeostasis
Mm-hmm.
because their brains can calm down that way a little bit. And if they come in defensive and keyed up because that's how they've been treated in such a way
Mm-hmm.
that those emotions arise.
Right.
And we give them a different environment to where they can feel like they don't need to be as defensive.
Yes.
That's kind of a brain homeostasis, a thinking homeostasis that I think is valuable to form those relationships.
Absolutely. I mean, the patient comes in and they're sitting there like this, and their brain is flooded. Okay, you got all these hormones in their brain telling them if they got the fight or flight thing going on, right? And in what I try to get across to my listeners in my talk is that we cannot underestimate what is happening in the brains of these people who are in our chairs. And
Right.
part of that is they can't breathe. And this, you look out and you see the patient, they're sitting there, they got forward head posture, they have a flat upper lip, and they come in and they're all bent forward. You can hear them breathing. And the patient sits down in the chair, and the first thing I say is, okay, you need x-rays. And the patient says, well, I don't want x-rays. And then we get into a fight about, we get into a power struggle about, well, this is why I need to take these x-rays. And I start dropping, legal terms and blah, blah, blah. And, but what it really is this person can't breathe. And if 9 times out of 10, when I look in their mouth, they're bruxing, they have tori, and it's very, if other dental people would just, you know, once you know that, you can't not know it.
Right. And when somebody is anxious when they're walking in the door for whatever reasons they're anxious, then you sit down and the first thing you want to impress upon them is your expertise, your power, like you said,
Mm-hmm.
your power struggle, and or your workflow or your office protocols, or this is how we do things here.
Mm-hmm.
Well, that is, I mean, that's not welcoming in any way. I mean, if we stop right there, it doesn't make them feel welcome. And so that means that we can take a process, we can take a protocol, we can take a set of objectives that we need to have for that patient's visit, because they don't want to waste their time in your office either.
Mm-hmm.
And we can coach that in terms and coach that in approaches and coach that in our cultural acceptance, that they feel welcome while we're guiding them through the process that we need.
Mm-hmm.
We can't diagnose periodontal disease or cavities without x-rays. And,
Mm-hmm.
that's not being a good doctor. And they didn't come in to go to a bad doctor.
Mm-hmm.
They came in to go to a good doctor. And
Mm-hmm.
that means we have to be able to communicate the value of that and listen to what their story is. And
Mm-hmm.
there we come around to sometimes it's very, very challenging, because there's so much misinformation out there about a lot of things
Yes.
that if somebody comes in and says, look, I'm not going to allow x-rays because of whatever misinformation issue they have,
Mm-hmm.
that can be very difficult to
Yes.
overcome. And so sometimes we do identify people that look at, I don't think this is the right place for you.
Mm-hmm.
But we can be kind and gentle about it. And then and we, help them understand they want to go to an office that, has a more congruent point of view to that
Mm-hmm.
particular issue. And they don't
Mm-hmm.
want to fight with us every time they come in. None of that kind of,
Right.
it doesn't work that way, right?
Right.
But you can choose many ways of identifying what's important to people, and
Mm-hmm.
kinder and more welcoming way you can choose, the more likely you're going to get honest answers
Mm-hmm.
too, because they will. It's like surveys.
Mm-hmm.
I'm always curious about surveys, and these days, it's all about polling and everything else. Because
Mm-hmm.
whenever you get a survey, you know what the answers are supposed to be.
Mm-hmm.
It's common to think, okay, well, you know what? Somebody asked me this, I know what I'm supposed to do. I
Right.
may not always do that, but I know what the answer is supposed to be. So you can answer these things in deceptive ways.
Right.
So if somebody sits in your office and they say, oh, here's a clear example, you're a dental hygienist, how often do you floss? And then the old joke is, well, now and then,
Yeah.
and so to get an honest answer, you got to create safe
Mm-hmm.
spaces.
Yes.
And a kind and welcoming atmosphere provides safe spaces.
Mm-hmm. Um, and yeah, the whole, how often do you floss? It's just ridiculous. You know, but and it's not just this whole clean versus dirty thing. I find to be the basis again of shame.
Mm.
People don't want to be made to feel like they're dirty. It's not really dirty. It's biological. This is a biological process happening because we have bacteria in our mouth, just like we have them on our skin, and they're getting in our bloodstream. And it's not a moral failing. It's biology. And in terms of patients with x-rays, what I have found is a lot of patients refuse x-rays because of the gag reflex or because of those tori. But
Mhm.
they saw Dr. Oz or somebody said, oh, x-rays are bad for you. So they cling to that. But if I can address with them, when I look in your mouth and I see on your last x-rays you couldn't bite down. So I'm guessing that you really have a hard time with x-rays. And they're like, yeah. And like, boom. All of a sudden it's like, you know, yes. Well, you know what? Let's try it and I'll coach you through. And I can't tell you how many times that's worked.
Yeah. Speaking of Tori, your example of Tori is so relevant because we don't have good data that says taking out Tori helps people breathe better.
Right.
But we do have data that says taking out tori and applying some myofunctional therapies so the tongue knows now how to operate in this space that it has now can make their quality of life better. And every time they go to the dentist, things are much better.
Much better.
Every time they have a bag of chips, things are better. I mean, just all kinds of things like that go on. And so we can help them identify the reasons for going through any kind of treatment that they don't want, because nobody wants surgery, right? And
Right.
so if you help them connect with a perceived benefit, then you
Mm-hmm.
have a much higher likelihood that they'll actually accept the therapy.
Mm-hmm.
And the more we can find out what their perceived benefits are, the more
Mm-hmm.
likely we can connect those recommendations we might have. Our expert advice, another thing that came in to get it from us is our expertise.
Mm-hmm.
And so we can't be shy about sharing our expertise, but if we can make sure that our expertise matches something that they're looking for,
Mm-hmm.
now we have a chance of having a great conversation.
how many patients have you seen that have uh, the classic Eiffel Tower tongue tie and tori, sleep apnea? It's all,
Yeah.
I've never seen tori without a tongue tie.
Well, I can't say that
Well,
I
I
don't have that
suppose I
information.
shouldn't say never, but rarely seen, uh, especially the large tori without uh, that tongue tie.
Since we don't really know why tori exist,
Right,
I'm gonna the prevailing idea is that it's a buildup of bone because of pressure and
right.
forces. Well, then we go uphill from there, and we are upstream from there, and we see, well, wait a minute, maybe those small jaws are causing airway problems, which are causing hyperarousal, which is causing clenching, which is causing stress on the bone in a certain direction because of the misshapen airway supporting mandible and maxilla. And so therefore, there's our concentration of stress.
Mm-hmm.
And tongue ties help create that as well, because as you and I well know, then a tongue tie doesn't allow the maxilla to develop well.
Right.
And so that means that that closes down the airway, and it's nothing's disconnected. It's all part of a big picture of influences, I'd say. Yeah.
And modern human life just does not uh, create a good situation in terms of development of our oral facial structures. You don't even need teeth anymore. Our diet is so soft, and our diet really induces dental disease. I mean, with the ridiculous amounts of sugar, and people are mouth breathing, so their mouth is dry. It's the perfect storm.
A few years, many now it's been many years ago. I wandered through the Safeway store, and somehow ended up on the children's food aisle. I don't buy children's food, but I wanted to end up there. I was aghast because that was my first exposure to kids sucking food out of a bag.
Isn't that the most horrible thing?
Yeah, and so then you go forward with that, and you talk to people who are believers in good nutrition and solid food and baby-led weaning, and we understand that the function of the bone, of the muscles on the bone, is what shapes the bone.
Mm-hmm.
Well, so you don't give kids a bag full of carrot, you give kids a carrot and let them
Yes.
chew on it, and so because that's what these bones and muscles are for. And so we give them a reason to exist that way, and then those tissues shape themselves properly. Now, lack of apoptosis and a tongue tie will warp that, but that's what we're for.
Mm-hmm.
And there's no part of medicine that has a closer ability to um, assess
Mm-hmm.
growth and development than dentistry. And
Mm-hmm.
and there's no other part of medicine that pays attention to this. I mean, yeah, syndromic kids, but traditionally developing kids, TD kids, have a wide range of shapes and sizes of these airway supporting bones
Mm-hmm.
that we can see when they're 3 and 4 and 5 years old.
Yes.
And so, if we can identify those craniofacial respiratory complex deficiencies
Mm-hmm.
early in life, well, then let's jump on it and fix that.
Mm-hmm.
And there's so many different ways that we can approach that depending on what your skill sets and interests and training and all those things
Mm-hmm.
are. But when we combine function with structure, then we can create these big open airways for kids to breathe through when they're finished growing. And oh,
Mm-hmm.
by the way, there'll be plenty of room for the teeth when that happens too.
Right. Well, Kevin Boyd talked about that when we
Of
were
course.
down in New York, and yeah, he's very passionate about all of that. And unfortunately, our culture, if a mother is supposed to go back to work 6 weeks after she gives birth, it's just there's a lot working against these kids. And what I'm seeing is, children um, are smaller in stature, and they have smaller chin. They have no chin. These kids, they have big puffy cheeks and no chin. That's adorable when you're one.
Mhm.
That is not going to develop into a well functioning orofacial respiratory complex. And,
My little granddaughter, Luna, is her mother is a dentist, and
Mm-hmm.
her grandparents are some of my are dentists that are everything but blood family to me. And so, and then her Luna's father is an actual rocket scientist, and
Wow.
so Luna has no chance of growing up without proper function.
He's
But there's a
literally a
lot of
rocket scientist.
yeah, there's a lot of little girls and little boys out there though that don't have that kind of protective family
Right.
situation, and so we can get that message out. And again, instead of going and buying a bag of carrots, buy a carrot, kind
Yeah.
of a thing. And
Yeah, mush in a bag. Yeah.
see,
It's yeah, well, kids need to, yeah, they need to chew, and they need like to eat, beef on a bone. They need to
right,
gnaw on bones.
right. Whole real foods is what
All real
and
foods.
we just had a great conference at ADA last weekend,
Yes.
where Robert Lustig, Robert Lustig's a wonderful guy, and his
Hmm.
message, you can wrap his message up as, sugar's bad for you.
Yeah.
But he has such a great way of explaining why it's bad for you and how to
Yes.
watch out for it. But the other speakers were talking a lot about function, a lot about making sure that you are paying attention to ingredients, and that whole ingredients and are going to give your body what it needs. We know about nitric oxide, for example. That's
Hmm.
produced for our lungs. It's produced in our sinuses, and so nose
Hmm.
breathing provides that nitric oxide our lungs need to be able to fill up, to be able to exchange gas, to be able to do all the wonderful things. But our body uses nitric oxide in every cell. Every mitochondria uses nitric oxide. So it
Hmm.
can all come from our sinuses, and it's come from all of our tissues in a lot of ways. What Dr. Bryan, one of the speakers, talked about was that nitric oxide is produced on your tongue by nitric oxide synthase, that it lives on the back of your tongue, but it doesn't work unless you chew the food up.
Oh
So
my gosh.
you can take a leaf of spinach and you can swallow the leaf of spinach,
Hmm.
and that spinach will pass right over top of that nitric oxide synthase, and nothing will happen.
You
You take
have
that
to,
leaf of
man.
spinach and you chew it up, and
Hmm.
all of a sudden you're producing a lot of nitric oxide that will be absorbed through your tissues and in through your gut.
Hmm.
And so the act of chewing makes food and substrates, let's just call it,
Yeah.
available to our bodies to be able to be actually used. So when you hear that, it's just so powerful to think about homeostasis again, because
Hmm.
we didn't our evolutionary ancestors, they didn't go to the store and get a bag of spinach.
No.
They went out to the field and pulled some out of the ground. And so that's what the more we can mimic that, the closer our bodies are going to be able to be healthy.
I'm very excited about that ADA conference because they're finally getting on board with the oral health care provider's role in general health. And I'm really happy about that because once the dental profession as a whole starts to get more involved in general health and getting away from fixing teeth, obviously teeth need fixing at some point, but it's just going to reduce trauma because it's going to be a completely different approach to oral health care. And I find that very it gives me a lot of hope, and I think it's really exciting.
Well, you'll be happy to hear that not only were the leaders of the ADA there at the wellness conference, but Whit Wilkerson, who's kind of heading up this conference along with George Shepley, um, are committed to this to the point where there's already planning for next year. And
Mm-hmm.
you may not know that I'm the head of the ADA's Children's Airway Initiative there, and so we have a
Wow.
Children's Airway conference. We put on our seventh one just in May. Well, Whit and I are going to be coordinating. So we'll have the Children's Airway Conference, and we'll also have this wellness conference, and we'll coordinate that to where we can have a synergistic message out there. And
That's
then
amazing.
Dr. Dave Preble, who's the Chief Strategy Officer of the ADA, sounds like a pretty important job. He,
Yeah.
Dave and I talk all the time, and he really loves the concept of us as part of primary care. And so
Yes.
primary care dentists. And so the the building from top to bottom, I think, is really poised to see dentistry take their place as part of primary care
Yes.
and wholly in charge of growth and development of the craniofacial respiratory complex, and very much involved with helping TD kids become their best selves by the time they're finished growing. And we take our place in medicine at that on that hill because nobody else wants it, and there we
That,
are.
yes, that makes me really happy. That fills me with a lot of hope. And I'm so happy that I got to talk to you today. And I knew it was going to be a great conversation. And so it's been talking for about 35 minutes, and the average person's attention span.
I think we're done. Yeah,
Yeah, but thank you so much. I knew this was going to be a great conversation, and I will look forward to running into you again.
absolutely. Let's make sure that happens. All
All
right.
right. Thank you. I'm going to stop
Thank you.
recording.